Hello, Rebecca. Thanks for having me on.
A pleasure. Firstly, how significant is it that Queensland now has a Minister for Mental Health?
Oh, look, I've heard some of your comments beforehand, but actually from our point of view, we're pretty excited about this. You know, we've had a parliamentary review, we've had a levy introduced, and now we've got a Minister for Mental Health, which really, from our point of view, elevates the issue in government. And, I try and be hopeful about these things and hope that really brings about some change.
It's been added to arguably the largest, most complex portfolio of health. Are you confident that Shannon Fentiman will have the time and the team to address the needs of the sector?
Look, mental health has always been in health, but I think what it does is raises, because it has its own portfolio, it raises those needs into, cabinet discussions. So actually, I think, it is a big portfolio and, health is really complex and there's probably never enough money to do everything that you need. But I think this actually raises it as a really important issue in its own right, rather than perhaps taking a back seat to acute health.
Jennifer, you represent community mental health and wellbeing services. So what kind of organisations are they?
So they're not-for-profit community organisations that are really delivering grassroots care to people within their communities, and they work with people to stay well and live their best lives in communities.
So what's
a really important part of the system, yeah.
Yeah, so just give us a couple of practical examples of the sorts of agencies.
Do you want me to name some names?
Yeah, just so people know what you're talking about, because, we're going to talk about what sort of budget hopes you have in a second so people can wrap their heads around, okay, you and your groups are on the front line. What sort of work?
So some of the bigger organisations are NEMI National, Footprints, Wesley Mission. There's a lot of them. We have over 100 organisations across Queensland that deliver these sorts of services, and they really work with people to support them to live in the community and to, as I said, live their best lives and actively support their wellbeing rather than just responding to illness.
Yeah, and I guess it goes a significant way to addressing those needs. I mean, everyone wants to live well in their community. It goes towards addressing those needs before someone ends up in an emergency department in a state of distress, which is, not where they need to be. So from your perspective, Jennifer, as the CEO of the Alliance for Mental Health in Queensland, how heavy is the demand on those community mental health services right now?
Look, I think it's great, but I actually think they could play a much greater role in the service system, and they could play a role in taking the pressure off the acute end of the system. I think we tend to fund more of the same, thinking we need more of one thing, when actually maybe a different solution is the answer. And we know those services are, they take 4.7% of the mental health funding in Queensland. So it's actually a really small proportion of funding, but greater investment in those could actually really help people get the care they need in their communities, rather than having to wait till they get unwell and turn up to an emergency department.
Yeah, gee. So less than 5% of the mental health budget is applied to those, you said 100 plus community mental health services. They're
just our members. There's more community services than just our members.
Yeah, right.
But yes, it's tiny. It's tiny. Yeah.
You're listening to Jennifer Black, the CEO of the Queensland Alliance for Mental Health. This is ABC Radio Brisbane. Queensland has appointed a Minister for Mental Health, Shannon Fentiman. It's part of her portfolio under health, but mental health has been elevated in terms of status. So, Jennifer, for you, what do you need, or what would you ask for from Queensland's new Minister for Mental Health?
Well, with the introduction of the levy, we understand a lot of the investment will be in the acute end of the system. So I'm really looking forward to meeting the new minister and having that conversation about how other countries have actually addressed this issue, because we know that all of the reports and reforms say that we need to make a shift to communities so people can get help early in their distress. And some places have done that better than others. And so, I think that's the conversation we need to have, is how do we make that transformation here in Queensland? We're a really vast community with communities dotted all over a huge geographical landscape. Everyone in Queensland needs to be able to access help early in their distress, regardless of where they live.
Yep. So a country that's comparable and addressing mental health well, who would you point out?
Yeah, so we know that New Zealand probably spends about 30% of their mental health budget on the community sector. So they've kind of made a shift. So I think we need to look at those sorts of countries that have made that shift, because I think every country in the world is grappling with this issue about how do we help people early in distress, because we know the demand is increasing. We need to do something different. And people with a lived experience have been asking for decades to do this differently. I think we've got a perfect opportunity. We've got to focus here on mental health. Let's do it the best way we can.
Jennifer, great to chat this morning, and I'd love to talk to you after you meet with your new minister, Shannon Fentiman. Thanks so much.
Great. Thank you very much, Rebecca.